Have you ever heard of a Bible cyst? Well, it's a cyst that can form on the foot or the wrist. It's basically a ganglion, and a ganglion is just an outpocketing of the joint fluid or the tendon lining, the tendon sheath. It fills up with joint fluid and it turns into a cyst. It's usually on the outside of the joint. It moves around. Sometimes it's painful, sometimes it's not. It gets bigger and smaller. And the reason they call it the Bible cyst is because way back when they used to fix it by smashing it with a big book like a Bible. So if you have trauma to the ganglion, it might go away. So I've actually scheduled people for surgery to remove a ganglion, and in the pre-op holding area, I go in and it's not there, so we have to cancel the surgery. So a trauma can get rid of it, but I don't recommend, if you do have a ganglion, trying to smash it yourself. Go see your doctor before you do that. You don't want to hurt yourself more. Another funny story about ganglions, my first job as a podiatrist, I was working with a doctor in upstate New York, and he had these big hands, so he'd go into the patient room, and if they had a ganglion, he'd talk to them casually and examine their foot, and then just take his giant thumb and smash the ganglion. It was, I don't know, it was kind of traumatic for all of us, except for the doctor. But of course, that way is not recommended to get rid of a ganglion. A lot of times we'll aspirate the fluid out and send it to pathology and make sure everything's benign. But usually when you aspirate out that fluid, it has a characteristic jelly, straw-colored look to it that is somewhat transparent. And if it keeps coming back and being bothersome, then it can be removed surgically. And usually when we remove it surgically, we try to tie off the stalk that comes from the joint or the tendon so it doesn't refill back up with fluid again. And thanks so much for watching. Here's your best foot forward, and we'll see you again next time.